The Herbert Irving Comprehensive Cancer Center of Columbia University Medical Center and New York Presbyterian Hospital has more than 250 members, 12 core facilities, and 8 research programs. In 2012, Dr. Stephen Emerson joined the center as director.
It is a singular, unique cancer center. First of all, by location, we are one of 3 comprehensive cancer centers in the state of New York, one of 2 in New York City, and we are the only cancer center on the west side of Manhattan. The key thing about New York is that the subways go north-south. You can't really get across the island, and so we're it from Chelsea up through the west side by Madison Square Garden, Columbus Circle, Columbia University, up to the tip of Manhattan, Westchester, and northern New Jersey. So we serve a natural local catchment area, as well as the research and tertiary services we provide serve a much larger area as well.
The Herbert Irving Comprehensive Cancer Center is one of the original cancer centers from the National Cancer Act. It's one of only 3 comprehensive cancer centers in the state of New York. And the great thing about Herbert Irving Comprehensive Cancer Center is that it offers both therapeutic clinical trials as well as standard treatments for patients who already have a cancer diagnosis and are in need of treatment. It offers survivorship research for patients who have been cured of their disease or otherwise are in remission. And it also offers all the way up at the beginning treatment for patients who don't have a cancer diagnosis and are undergoing screening and are involved in what's called cancer prevention and control research.
In their recent review, the NCI praised Dr. Emerson for his leadership, noting that his guidance helped produce exemplary results.
Among cancer centers, we have singular programs in cancer genetics, immunology, and in stem cell biology that inform all the work and all the clinical trials we do. And so it creates a very both vibrant, investigative, scientific, and community-serving cancer center.
Over the last 5 years, we've developed a very robust clinical trial portfolio at Columbia University for thoracic oncology patients, and that includes patients with all different types of lung cancer, but also esophageal cancer as well. And currently, our portfolio is the best I've experienced in my lifetime as a clinical investigator. So we basically have a clinical study, front line, second line, third line, for almost any patient coming with different forms of metastatic non-small cell lung cancer. But we're also able to introduce studies for locally advanced lung cancer patients. For example, we just opened one that's focusing on EGFR inhibition in patients with stage 3 lung cancer, as well as post-surgical adjuvant treatment studies. So I think the portfolio is very wide. We're not focusing specifically on only phase 1 or phase 2 studies. We want to make sure that we have a fair balance of studies so that each patient could benefit from an important key study that could lead to advances in the field as well. And that includes both more conventional clinical studies, targeted agents, and innovative immunotherapy studies as well.
The NCI recently ranked the center as outstanding for basic research, translating discoveries into treatments and a dedication to patient care. This, in part, comes from the Cancer Center's affiliation with Columbia University.
It's a fantastic group of faculty throughout the university beyond areas we normally think of as involved in cancer centers, including bioengineering, synthetic chemistry, philosophy and ethics, economics, psychology. So as we think of our work in building community service, in designing the best new therapeutics, in figuring out how to establish a cancer screening and prevention network that protects patient confidentiality and safety while providing the most decisive analytics and therapy, it's fantastic to be involved in this university.
For many of those who know me in the field, I spent a decade at Memorial Sloan Kettering Cancer Center, and several of us moved to start a new leukemia and malignant hematology program here. I think one of the benefits about being at Columbia, which is definitely unique from where I had come from my prior institution, was that here I can get other services that I necessarily couldn't get at a small Cancer Center. So if patients have other medical problems, they have heart disease, which again, most of my patients do because it's the disease I deal with is an older patient population. You know, they're in their 70s. They have diabetes, they have heart disease, they have other medical problems. You know, it's an advantage to be at an academic center who does other subspecialties, because if I have an immediate problem, you know, I can get them services without sending them to another institution, which is what I had to do prior. You know, if I have a patient who's got heart disease in the middle of chemotherapy and then has chest pain, I'd like to keep them here because I can manage their blood and their hematologic problems while they're on chemotherapy, but I have a cardiologist who can deal with them, take them to the cath lab. You know, so that is definitely one advantage, you know, that I didn't have prior that now I have at coming to Columbia, is I have other physicians and other subspecialties who are experts in those, you know, medical problems who can handle that while I'm dealing with their leukemia. So I definitely think that's an important step up.
Palliative care represents an important part of effective cancer care. To address this need, the Cancer Center is building an extra layer of support through its adult palliative care services.
We're still in our nascent phase of developing an ambulatory palliative care program. We have developed inpatient service, 2 inpatient teams made up of an MD, nurse practitioner, social worker, and chaplain that see patients throughout the hospital in the ICUs and on the general floors. In the outpatient side, we have an MD and nurse practitioner that's integrated now into the Cancer Center, but it's still growing. We're hoping to put this together into a larger umbrella of supportive care services here in the Cancer Center, that will hopefully benefit all the patients that come here, not just those who need palliative care, but need other services like nutrition, you know, social work services, psychology, you know, other integrative therapies that might be of benefit. So that's the goal. And I'm hoping within the next few years we're going to grow this outpatient program so that all patients that step foot in the Cancer Center will have access to supportive care services and be able to benefit from that.